We will talk about signs of high cholesterol. It's extremely common condition because affects around 50% of adult population. And now let's explain what is cholesterol and why it's important at all. Cholesterol is waxy fat-like substance. It is represented in our body normally. It is part of our cell structure. It is represented in lipid bilayer in our cells, cell membrane, and its structural component of our cell membrane. Also, it's important for hormone synthesis, especially for synthesis of vitamin D. It's crucial. Also, cholesterol is important for digestion because from cholesterol we get bile acids, and bile acids are important for fat digestion. And cholesterol is produced in liver. Majority part of cholesterol is produced in liver. But we can intake cholesterol directly also, but it's minority of portion. We can get them from fatty meat, from eggs, from poultry, but majority part is synthesized in liver. Also, trans fats are rich in cholesterol, and trans fats directly helps to synthesize cholesterol, and especially bad cholesterol. Also, sedentary lifestyle, obesity, being overweight are risk factors. And now let's say what means bad cholesterol and good cholesterol. We have several types of cholesterol. First is LDL, or low density lipoprotein, and we call it bad cholesterol. Why we say they are bad cholesterol? Because they contain lots of fats and they are waxy, and when they are travel into bloodstream, they causes buildup of cholesterol in the blood vessels wall. So they can cause buildup cholesterol, which we call atherosclerosis. You can see here. That's why we call them bad cholesterol. And good cholesterol is opposite. Good cholesterol is HDL, not LDL. And what means good cholesterol? Good cholesterol has more proteins and less fats, and it has able to clean blood vessels from cholesterol. That's why we call it good cholesterol. And triglycerides. We have triglycerides, another type of cholesterol. Triglycerides are also bad type of bad cholesterol, and they deposit into body as a fats. So when we gain weight, we can gain weight because of triglycerides. These triglycerides are deposited into our body. Now let's say what are the signs? What are the most important signs of high cholesterol level? First, we should say that it's considered silent condition, meaning that there is no clear signs and early symptoms of high cholesterol, and person can have a high cholesterol level for years without any symptoms. But when we have symptoms, we should know how to spot them. First is xanthelasmas. Xanthelasmas are deposition of yellowish lumps on the skin around the eye, and in many cases it is sign of high LDL or high bad cholesterol level, especially if it occurs before age of 40. It's highly correlated with high cholesterol level. So if person has fat depositions around the eye or on eyelid, it sign of high cholesterol level, and it is called xanthelasmas. Another sign of high cholesterol is xanthomas. Xanthomas are fatty deposits also on the hands, on the elbows, on the tendons and buttocks and different parts of the body. It's also cholesterol deposition, and it's also signs of high cholesterol level. It has very strong correlation with high cholesterol. It's common in case of familial hypercholesterolemia, also common in case of liver disease, and it has very strong correlation with high cholesterol level. Third condition is corneal arcus. What means corneal arcus is a gray or white arc around the cornea. It is called corneal arcus, and corneal arcus also before age of 40, if it occurs in young ages, it is also correlated with high cholesterol level. And peripheral artery disease is very important sign of high cholesterol level. It usually occurs after 50, but it's possible before 50 also. And main symptom of peripheral artery disease is intermittent claudication. What means intermittent claudication? It means that person has pain when he walks. When person walks some distance, after some distance, he or she has leg pain, usually calf, but possible thighs and buttocks also, and this pain will go away after rest. So it's intermittent claudication. It is sign of peripheral artery disease, it is sign of atherosclerosis, and it is sign of high cholesterol level. There is very strong relationship between peripheral artery disease and high cholesterol level. And yes, you may have questions that what if I walking and I'm tired and I have pain in my legs? It's not same. Of course, it's different, because here person knows that after, for example, 300 meters, he will have leg pain and calf pain. It's intermittent claudication, and intermittent claudication will worse over time if left untreated. So intermittent claudication is different from just tiredness. And angina is also sign of high cholesterol level. It means chest pain, which is described as a pressure or squeezing or heaviness or tightness, and person says that it's just behind breastbone, just behind sternum. And this pain can radiate into hand, into jaw, into shoulder, into back. So pain can radiate. In case of angina, angina has triggers. Triggers can be stress or physical exertion or cold weather or other environmental factors. Usually angina has stress. Angina lasts for several minutes, and it will relieved by rest or intake nitroglycerin. So angina is a condition which happens before heart attack. So angina is already red flag, and we should actually it's very important syndrome, and very important syndrome, especially people after 40, and it indicates cardiovascular disease, and it indicates high cholesterol level, and it requires treatment. Now let's say, how can we diagnose high cholesterol level? First and most important test is lipid panel test, and during lipid panel we define total cholesterol, LDL, HDL, and triglycerides. And if total cholesterol is more than 200, usually is considered high, and it increases heart disease risks. And if LDL level is more than 100, it also increases risk of heart disease. And now let's say, what is treatment? first line treatment is intake low in saturated and trans fats, regular exercise, weight loss, and smoking cessation. And second line treatment is statins. Statins are important medication which decreases LDL level importantly and radically, such as atorvastatin, pravastatin, simvastatin, rosuvastatin. They are very effective and they have less side effects, and they can be intaken for several years, so they are designed for long-term usage. Statins are very effective treatment for high cholesterol. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.